Hi, I'm Dr. Thangudu. I'm a physician who specializes in diabetes, thyroid, and other hormonal diseases. Thanks so much for being here today. I started this channel to bring my clinic to you because you may or may not know that there is a major shortage of endocrinologists in the US. By being here, I hope to give you the experience of seeing an endocrinologist, even if you're struggling to see one. Today, we're going to talk about Hashimoto's hypothyroidism. There is so much information on the internet about this that I hope to clarify some things for you and hopefully teach you some things. Since hypothyroidism is such a big topic, I'm going to break this into a few different videos. This first video is going to be on the pathophysiology of Hashimoto's hypothyroidism. Hypothyroidism, or underactive thyroid, is most commonly caused by Hashimoto's thyroiditis. Hashimoto's is an autoimmune disease where there are antibodies made by the body to attack its own thyroid. Over time, this can lead to underactive thyroid, which means the thyroid does not produce sufficient thyroid hormone for the body to function normally. So why does this happen? Autoimmune diseases occur when the body recognizes itself as other, so it creates antibodies to itself. There are many different kinds of autoimmune diseases, and Hashimoto's is just one of them. In Hashimoto's, the most common autoantibody produced are thyroid peroxidase antibodies. Some patients have thyroglobulin antibodies. These antibodies attack the thyroid and cause apoptosis. That means cellular destruction of the thyroid. Over time, the destruction gets so severe that the thyroid stops producing sufficient thyroid hormone. Usually it takes about 90% of the thyroid to be destroyed before we see abnormal thyroid function. The time course of destruction is variable. Some people develop hypothyroidism as infants, and some people who have positive antibodies never develop hypothyroidism. Hypothyroidism is more common in women and as people get older. Sometimes Hashimoto's can present with a goiter or enlargement of the thyroid. Over time though, as the thyroid is destroyed, we see thyroid atrophy or shrinking of the thyroid due to autoimmune destruction. An ultrasound is not always necessary for hypothyroidism. When we do look at the thyroid under ultrasound, we often see heterogeneity. That means variability in the texture of the thyroid. To me, that represents areas that have been destroyed by the antibodies. Sometimes these areas can look like thyroid nodules, so we call it pseudonodular goiter. Hashimoto's is really common. More common in women, about 3.5 in 1,000 women have Hashimoto's thyroiditis, and about 0.8 in 1,000 men have Hashimoto's thyroiditis. As I mentioned before, not everybody with positive antibodies develops hypothyroidism. So if you've had a test for antibodies and they're positive, there's no need to worry. Just check your thyroid function yearly or if you start to develop symptoms. So, recap. Hashimoto's thyroiditis is the most common cause of hypothyroidism. It's more common in women, and its prevalence increases with age. It is due to autoimmune destruction of thyroid cells. In the upcoming videos, we'll cover lots of frequently asked questions regarding Hashimoto's, like what labs do we order? Why do we order those labs? Why don't we order certain labs? What are some treatments for hypothyroidism? We'll also talk about common dietary recommendations made for Hashimoto's thyroiditis. We'll also talk about common supplements discussed in the context of Hashimoto's thyroiditis. We'll also talk about symptoms of hypothyroidism and what we can do to make them better. Thank you so much for listening. I'm here to provide evidence-based information and to help heal some of the confusion that is out there regarding thyroid disease. Please like and comment, and please share with any friends or family who you think could benefit from this information. Thanks so much for being here.